So now let's look at the ventricular tachycardia, a dangerous arrhythmia. What is ventricular tachycardia? Ventricular tachycardia, usually the rate is about 100 to 300 beats per minute. It can be monomorphic or polymorphic. For monomorphic, all QRS complexes similar or from one location in the ventricle. For polymorphic, there's constantly changing morphologies or from multiple locations in the ventricle. And again, if further categorized by the length of arrhythmia, it can be sustained, that is more than 30 seconds in length, or in need intervention to terminate, or it can be long sustained, that is less than 30 seconds in length. Here is an example of monomorphic VTAC. The origin is from ventricles. Here is a single focus. Why? Because it's monomorphic in morphology. It's a re-entry initiated by abnormal automaticity or trigger activity. It's usually rapid, wide, and regular QRS complex. So here are two strips showing ventricular tachycardia. The rate is 100 to 300 beats per minute. It's wide QRS complex. That means the QRS complex duration is more than 120 milliseconds. It's relatively organized rhythm with regular QRS complexes, and AB dissociation sometimes can be seen from the ECG. Here is an example of paroxysmal ventricular tachycardia. You see here this normal sinus rhythm from the sinus node, and here suddenly a very irritable ventricular focus discharged rapidly, giving rise to a ventricular tachycardia, a wide complex tachycardia. So the sinus P wave may sometimes recognize between the QRS complexes. The retrograde conduction from ventricles to atria is possible in VTAC. There we may be able to see the capture bits with a normal appearing narrow QRS occasionally occur. And sometimes you can see the fusion bits. And these bits may be observed with intermediate QRS morphology. And these capture bits and fusion bits are characteristics of ventricular tachycardia. So if in the strips of wide complex tachycardia, if we see the capture bits or fusion bits, then they are diagnostic of ventricular tachycardia. So here is an example. This is a fusion bit resulting from a fusion of a normal QRS complex and a tachycardia bit. So a morphology intermediate between the normal QRS complex and the tachycardia bit. And this fusion bit is a characteristic of ventricular tachycardia. Now, let's look at some polymorphic ventricular tachycardia. So, contrasting to the monomorphic VTAC with single morphology, polymorphic VTACs are with multiple morphology. It originates from the ventricles, so-called a wandering single focus, and it's a re-entry mechanism with movements in circuits and initiated by abnormal automaticity or trigger activity. Again, it's wide and irregular QRS complex that changes in axis. As you can see here, there's a polymorphic VTAC change in axis. There's a wandering focus in the ventricle. This is an example of polymorphic VTAC, or called the torsades de Pons. It originates from the ventricle. Again, it's due to re-entry. The rate is 200 and 250 beats per minute. It's associated with long QT intervals. It can be congenital or acquired long QT. And the QRS changes axis and morphology, alternating positive to negative. You see here, the axis actually changes. And torsades actually means the electrical activity appears to be twisted into a helix. So this torsades means twisted into a helix. So it's a classical example of torsades. How is the treatment for this dangerous arrhythmia? Magnesium infusion is a recognized option of treatment. Even if the serum magnesium levels are normal, magnesium infusion is useful. Or we can aim at eliminate pauses or increase the heart rate by isoputernary infusion or pace the atrial or ventricle temporarily. Of course, it's important to avoid drugs that prolong the QT interval. Some other examples of trigger automaticities include Bugarda syndrome. It's characterized by specific ECG changes caused by genetic mutations, and the treatment in high-risk patients include implantable cardioverter defibrillator. Here is an example of Bugarda syndrome. If you see the V1 to V3, there's a right bundle branch bar pattern with ST elevation. So right bundle branch bar pattern with ST elevation is a classical ECG pattern in Bugarda syndrome. Afibrogenic right ventricular dysplasia will also give rise to ventricular tachycardia. This ARVD is a genetic disease that causes cellular changes in right ventricle and leads to ventricular dysfunction and arrhythmias. The arrhythmias sometimes can be lethal.